There are a lot of causes of hip pain. I think about it in terms of inside the hip or around the hip. The common causes in the young adult would be things like femoral acetabular impingement, also known as FAI for short, labral tears, which are within the socket of the hip, ligamentum teres tears, and osteoarthritis. I mean, a lot of patients develop degenerative joint disease quite early because they are very active and they wear out the joints. So those are probably the most common cause. And the other thing outside the joint that can mimic hip pain would be trochanteric bursitis or flexor pain tendinitis, psoas tendinitis. Those are the common things that I see. In terms of assessment, we go back through history, examination, and investigations. The most important thing is with the history, hip pain can be quite variable. A lot of patients complain of groin pain, buttock pain. Sometimes they present with thigh or knee pain, but it's actually referred pain from the hip. The thing with the examination is to look for pain on movement, both active and passive, to see if the hip is irritable. That tells me that the pain is intra-articular, meaning it's coming from the hip joint itself. The first investigation that I would organize would be a plain X-ray of the hip, and that will diagnose the majority of cases. MRI scans can sometimes be is sometimes necessary because it's useful for soft tissue pathologies like labral tears, ligamentum teres tears, and other conditions like bursitis or tendinitis. Once they have that gamut of investigations, usually is enough to make a diagnosis and organize management. In terms of the options available after non-operative management have been tried and failed, the two broad categories would be hip preserving options and hip replacing options. So the line in the sand is whether or not there is osteoarthritis or degenerative joint disease in the hip. Any condition that affects the hip at the end will lead to a joint that becomes degenerate. Once it is worn out, the only option available, if they're still in pain, is a hip replacement. But if the joint is not worn out, then hip preserving options may be appropriate. In that setting, it would be things like hip arthroscopy, where we can perform keyhole surgery into the hip to repair the hip, reconstruct the hip, and to alleviate pain. Okay, in terms of when GPs should refer patients, I think a lot of young patients, pediatric patients who present with hip pain should be referred early, because a lot of younger patients less than 18 don't necessarily complain about hip pain. Most teenagers don't talk to their parents, and if they complain about hip pain to their parents, it's usually quite serious. For young adults, if they have pain for over 3 months, I think that's an indication to refer, especially with an X-ray and with an MRI scan, because that will diagnose the majority of bone and soft tissue problems in the hip. A lot of young adults with pain usually present with FAI or labral tears. The thing that I would be more concerned about is young patients who present with a traumatic hip history, either secondary to 4, especially if the hip is very irritable with pain on passive movement. The other patients with tendinitis or bursitis, after having tried injections and physiotherapy, if they're no better, the hip arthroscopy may be appropriate as well. And again, I would wait about 3 to 6 months for that. I think GPCE is a very good forum for GPs to come in to meet the specialist so that they can actually ask questions that they're unsure of. It's also a good interactive tool for learning and also for collaboration. They can learn about the latest technology or the latest surgical techniques that we can employ to help treat patients now, and it opens up the treatment options available for patients presenting with clinical problems.